And welcome back. Well, chronic pain can be life-altering. If you've been to many doctors and therapists and relief has just not come from that cortisone shot or physical therapy or even surgery, then our next guest may have a solution for you.
Dr. Neal Pollack is back to talk about two very specialized pain therapies. Great to see you.
Yeah, thanks for being here.
So what are these two therapies that you're using?
The two therapies are Prolotherapy and Perineural Therapy. In the past, I've talked about prolotherapy, and this is in the category of regenerative treatment. Maybe you've heard of stem cells, maybe you've heard of PRP, which is a platelet treatment. Well, prolotherapy has been found to be the most efficient, cost-effective way to regenerate these tendons, ligaments, and joints. And it has enabled many people to decrease their pain, increase their movement, and avoid surgery. What is even more exciting to me is perineural therapy, because the name describes a little bit of it. It's treatment of nerves and the area around the nerves.
Okay, so what is perineural then? If it's treating the nerves, how would people use it, and tell us a little bit about it?
A lot of pain problems throughout the body, if you trace them closely, have areas of sensitivity, knots, inflammation, and pain associated in patterns. And if you closely observe this, it is in patterns of nerves, usually sensory nerves. So what has been found, and this treatment has been designed by a specialist from New Zealand by the name of Dr. John Liftoff. And he experimented on himself initially, and then he's been training around the world. And it's been revolutionary. I've seen patients, and I've treated patients personally, who have had chronic pain in numerous areas, whether it's headaches, arm pain, back extremity, throughout the body, by giving a specialized solution of a sugar base that is buffered to essentially resuscitate the nerves that are putting out these chemicals. It decreases and almost eliminates the pain.
And see, I think this is fascinating, and people should know in terms of the areas that you're talking about. You mentioned the neck and the back and things like that, but there are a lot of different painful conditions that have been treated, you say, by the perineural therapy with very high success rates. So that includes whiplash, the neck, back, shoulder pain, groin pain, pain after surgery, which a lot of people are frustrated, taking a lot of medication, cortisone shots, physical therapy, also just chronic regional pain, persistent sports injury pain, fibromyalgia, migraines. I mean, that's a whole long list of different painful chronic conditions that people have.
It certainly is. And if you're not responding to some of these conventional treatments that sometimes numb the area or use chemicals that try to decrease the sensation from the brain and make you dizzy and don't completely work, you have to experience this, because if you are a responder, the odds are that with subsequent treatments you're going to either significantly eliminate or decrease your pain to levels that are doable.
Is it an injection?
It is. It's a very, excuse me, it's a very minute injection just under the skin with a very tiny needle in the distribution of this nerve region that is involved.
And is it like you get an injection, so like a cortisone shot, for example? Sometimes people will have multiple, but you have this shot and then you kind of wait to see if it alleviates pain and inflammation. Is this something where you do multiple treatments?
It is something that if you are a responder, you're going to know after you get the treatment right away. It's amazing. People with various problems. It's just the other day I treated somebody with a shoulder problem. All of a sudden they're moving the arm. Oh, that feels good. So if you're a responder, you're going to know right away. And the response initially works for days to a week, and then with subsequent treatments, the level significantly decreases or is eliminated completely.
Wow.
So done right in the office, less invasive, less expensive than other therapies. People
Yes.
can meet with you and you can take a look at their injury, decide and talk about their pain. Because what you say at the end of the day, nobody should have to live with pain, especially chronic pain. So if you don't do it anymore. Call Dr. Neal Pollack and he can help you with some different therapies that he offers and find out what's right for you. MilwaukeePainClinic.com at 414-453-7780. And again, these two treatments were Prolotherapy and Perineural injection therapy. Thank you so much for being here.
You're welcome.
Thank
Appreciate
you.
it.